Thank you, Mr. Chair, members. I appreciate this opportunity to lay out House Bill 3121. The origins of this bill were in conversations I had with the Becker family, and you will hear from them in just a moment about their experience. But I continue to have further conversations with constituents and with the mental health advocacy community, the residential treatment center industry, hospitals, psychiatrists and psychologists, and now state regulators. And a conclusion I reached from all of those discussions is that in Texas, we currently have a weakness at a certain point in our continuum of care for mental health for teens and adolescents. And what I'm referring here specifically to is in providing high quality options for families for temporary residential treatment of teens and adolescents who are experiencing serious mental health difficulties. And I'm not talking here, by the way, I'm not focusing today on hospitalization. Hospitalization is usually at a moment of an acute crisis, and it's for a few days. I'm also not talking about the general availability of mental health resources in schools and the preventative aspect and the early ability to catch mental health issues. And I know, by the way, there are true leaders in mental health issues on this committee who have worked very hard on all these issues. The focus, though, of this bill that I'm bringing to you today is at that point after hospitalization. Let's say there has been a suicide attempt, for instance, by a teenager or adolescent. They've had to stay in the hospital. At that point, it is often the case, as I have concluded and learned, that the best thing for them would to have a high quality option for a place to stay for a period of time where they can receive high quality psychiatric or mental health treatment in a residential setting. And that is where I believe we currently have a weakness in Texas in our continuum of care. And that's what this bill is intended to address. So members, thank you for letting me lay out that background. What this bill would do is to establish a voluntary certification process in our state for centers that treat teens and adolescents for psychiatric and mental health problems, and that would require these centers to meet certain standards in order to have the certification. In Texas, we currently do not license any kind of center for treatment of mental health issues for young people. We currently, of course, license our hospital, including our general psychiatric hospitals, and we do license child care facilities of all kinds. And we license those generally under the same provision of code. It's Chapter 42 of the Human Resources Code, where we have a basic license to take care of children in all kinds of residential settings, but nothing that focuses on mental health. The current regulations deal with really just basic health and safety standards. So what this bill would do is to introduce a process of certifying facilities that meet specific standards for mental health treatment for teens and adolescents. And I think this certification could be important information for families that find themselves in this difficult situation, needing to know what kind of facility they may need to turn to. Members, I'll make a few final points, and I so appreciate your time. First of all, the concept in this bill already exists in other states. What we're defining in this bill is something called a PRTF, Private Residential Treatment Facility, although the focus of this bill is on ages 21 and under. So we're not making up a new concept out of nowhere. This does exist as a licensing option in other states. Second, this bill is not going to replace any of the current standards we have in place to license residential treatment centers. So if a residential treatment center wanted to try to meet this standard, it still is going to have to get its license, its regular license as a residential treatment center, and meet all those health and safety standards that it already does. But it would then do some extra things to meet this extra certification. And finally, I want to emphasize that in this bill, this would be a voluntary certification. So it's not a new requirement. It's only if a facility wants to open up and obtain this certification, or if an existing facility wants to potentially upgrade and meet the requirements in the bill for the certification, which include things like accreditation by a major accrediting organization. It would include a specific plan of treatment, a certain kind of staffing available, and other elements that are laid out in the bill that match the criteria for a PRTF, generally speaking, that as I've described in other states. As we're trying to incentivize voluntarily a movement to quality among residential treatment centers and a focus on mental health issues for those kids that need it. So members, we've been able to talk to people like Children's Hospital in Dallas, Texas Hospital Association, Texas Association of Child and Family Services, mental health advocacy organizations like NAMI, And I'm proud to have their support for this bill. We've had a lot of conversations about this. I personally have learned a lot in pursuing this bill, and I'm grateful for the opportunity to lay it out for you today. I may say something briefly about the fiscal note in my closing, but I'll leave that for later. But thank you so much. I'm glad to answer any questions you have.
Thank you, Representative Turner. Really appreciate you bringing the bill and tackling what is a very challenging issue, and I know you and I have talked about it. I wanted to ask you a couple of quick questions.
Yes, thank you.
If you don't mind. You know, just so we all understand, I mean, what's been your assessment of the resources that are currently available for this segment of the population who may need mental health treatment and care? And secondly, you kind of emphasized this right in your last comments, but we're talking about a certification, a voluntary certification, which is completely voluntary, not a licensure, not the creation of a new license under your bill, but a certification. So how did you come up with the standards for certification? You know, how did you come up with the language that you've laid out in your bill?
Thank you very much, Chairman, for the questions. I want to acknowledge, by the way, your leadership in this area, mental health for children, especially all the great progress we did make last session. That was very important.
Yes, I think everybody on this committee that was
and then I was going to say, this is a committee of people that have really many leaders in this area, and I appreciate your interest in this issue. Well, the first question you asked is, where do we stand right now? Well, you know, what I've learned in this process over the last months, as I've had all these discussions, is that we have a lot of residential treatment centers in Texas, but they're not, generally speaking, they're not focused on treating psychiatric and mental health issues specifically at a high level of, I would say, standard of care or quality. Now, of course, there are many that are doing very good work, but I'm talking about the focus on specifically being available for kids that are undergoing severe mental health issues. What I've seen is that the centers often will treat multiple kinds of issues. It could be substance abuse. It could be just kids that are in need of custodial care, or kids that have had behavioral issues. And we want high quality for all of those things, by the way, and I want to be clear about that. But it's also when you're trying to treat a serious mental health issue, maybe there's been an attempted suicide, something of that sort, you know, a level of specialty is important. And I think it's important for families that find themselves in this difficult situation to be able to distinguish the kinds of facilities that are there. And if the state had a specific certification here that gave that bit of extra information to a family, I think we could be doing a service. And that's really the intention there. Now, as for the standards, Chairman, that you asked about, what we tried to do is draw from the existing standards for that PRTF that I've described that exists in some other places. And, you know, it's not a long bill, and there would be some further rulemaking by the agency about some of the details regarding the standards they'd have to meet. But fundamentally, you're talking about a facility that meets accreditation standards under one of the major accrediting organizations, a facility that is going to have a detailed plan of care involving all the right professionals. That's going to involve the family, and that's something I want to emphasize as well, by the way. You know, when the child can be treated at home, well, that's often the best thing to do, and I want to be clear about that. But there are these circumstances where it's not that maybe they've just been hospitalized. It's not the right thing to go home immediately, right away for the child, or that may be the conclusion of the family and the medical professionals. And so there needs to be this option that is available, and we just want there to be high quality options.
Thank you for those answers. Any questions, members of Representative Turner? Representative Smith?
No, go ahead.
No, go ahead.
Vice Chair Garrett?
Thank you very much. Thank you for bringing this important legislation to our attention and for filing it. And for many years, I represented the Mental Health Authority in the Rio Grande Valley, and more specifically in Edinburgh and in the Upper Valley. When I'm reading this bill, when it comes to the Mental Health Authority, and I also understand it's voluntary, how does this blend with the Mental Health Authority that is established, such as MHMR?
Thank you, Vice Chair. Well, in my view, this is complementary. It's intended to just be an addition to our existing continuum, but one that has the specific focus of A, children, and B, residential care. So we're talking about, again, a continuum of care ought to exist all the way from early detection of possible mental health issues, widespread availability of resources for children as well as adults, of course, that are beginning to experience mental health problems. But at a certain point, we get to possibly a post-hospitalization situation for a child where a family may just not know where to turn. And really, it could, I think, Vice Chair Garrett, integrate with all of our existing local mental health authority infrastructure. It's just another option, another place where a family can turn and say, okay, here is something that the state has specifically identified as having met certain standards related to mental health treatment for youth specifically, and that's extra information for them if they decide voluntarily to go there.
Okay, so then the state mental health authorities located in different parts of the state, this would blend in if they choose to do so.
I believe so. I sure do. Of course, this is the focus here is on private centers. Now, of course, many of them may obtain funding from treating children through state support one way or another. But the focus here is on private centers. But I see no reason that couldn't be an available option that could be, for instance, recommended by local mental health authorities.
Private centers, okay. And have you had an opportunity to speak with the commissioner about this? Because I think it's a wonderful idea. And I can tell you, when my discussions with the executive director back home, Tropical Texas, I have been over there and I have seen them really focus also on the youth in this regard. And so I think it's a wonderful idea, but if I may suggest you speak with the commissioner, if you haven't done so already, because I think it would be important for them to encourage those type of state facilities to delve into this.
Thank you, and I agree that is a good suggestion, and I will follow up. I've spoken to people inside HHSC who are responsible for the appropriate regulatory areas about it, but I agree with you.
And Dr. Hellerstadt is obviously consumed with the COVID issue throughout the state of Texas, but he's a very gracious individual, and I think that he would appreciate the discussion in this regard. So thank you again for fine legislation that should get passed. Thank you.
Thank you, Mr. Vice Chair.
Members, any other questions? Representative Smith?
John, thank you for bringing this bill. I don't think there's ever been a better time for bills like this. And I was reading the bill analysis and I read the bill and I was noticing where it says we're trying to encourage these facilities to do these things. And I just wanted to give you an opportunity to maybe talk about how it is that this bill encourages or incentivizes facilities to take this step.
Thank you, Representative. I appreciate the question. And again, it allows me to emphasize, I decided in this bill not to try to come in and have a new mandatory license because I did not want to, A, put anyone out of business, and B, inadvertently have the effect of decreasing capacity in the residential treatment industry, for instance. Now, I do believe, though, that entire industry would benefit by, in essence, incentivization toward quality standards. And that's what this is intended to do. If a center decides to try to become certified under this new program, if this bill passes, what it would do is be, in essence, a credential, something that would distinguish them for their focus in this area and for having met certain quality standards. And it's my hope that then, in turn, that's something that the public would want to know, and that center would want the public to know, because they're trying to emphasize that they have been certified by the state in this way. And I've made some inquiries with the industry about whether they think if this passed, whether centers would attempt to do this. And I've received some positive response about that. And so I do believe this is the type of thing that once we create this structure, we're hoping to voluntarily incentivize this kind of movement, and it would be a good step forward.
Thank you.
Thank you.
Other questions, members? All right, we'll reserve your right to close.
Thank you.